In South Yorkshire and Bassetlaw, it's really important to us that we build up and scale and diversify green social prescribing. And in doing that, we want to increase access for everyone who lives in our area. The communities that we're particularly keen to engage are Black, Asian, minority ethnic communities, people with experience of mental ill health, young people, people who are clinically vulnerable to COVID, and people who live in the most deprived neighbourhoods and communities across our area. So for us it was really important to focus on co-design to ensure that those communities were understood and that we worked with communities to develop the best solutions. Grants panels brought together a wide range of partners, including our local authorities, our CCGs, our voluntary and community sector, and people with lived experience of mental ill health. And that was a really fantastic experience that really genuinely helped us to make some very good decisions about where to invest our money, which community projects to sponsor, that we knew would be used by the people that we're trying to connect. We commissioned the Sheffield and Rotherham Wildlife Trust to be our green experts, and they worked with our social prescribing teams in each of the 5 places in our system.
We had some really successful workshops where we involved community organisations, voluntary organisations, people from the health sector as well, to explore how we could make a difference. We also ran some focus groups and we worked with activity providers so that they could ask people the questions as well.
We've had 2 organisations who have joined up now. Our BAME communities are really confident using those organisations because they're trusted organisations, and together they're delivering a really great project.
We've got the gardening group going, we've got 2 groups going, so we're mindful of the fact that women wanted a women only group, so we've catered for that. So we've got a day where we're doing women only, but then we're also having another day where it's a mixed group, so where we've got men and women, so we're kind of like meeting the wider needs as well of the community.
And get it more developed.
And now we're using the same methodology to do our green prescribing network and also our community of practice, which is really supporting grant recipients making the most of their projects.
When you co-design, you're much more likely to get interventions that are based on the experiences of the communities that they're intended to serve. So you will get a better programme as a result.
We quite quickly learned that food was and the learning how to cook food or people having access to an hot meal and the social side of having a meal was kind of key. And then we always had a craft activity because we got people with chronic pain or mobility issues, so we would have something where you could actually sit down to do an activity.
I think doing things outside, it's a little less pressured than if you're in a room or an office. You can walk away if you need to. It's a better environment in a lot of ways.
There's that many different things you can do and be outside and get that fresh air.
This has been absolutely fantastic and I can't thank the doctor enough for prescribing this.